Welcome to True Health Tuesday, and the truth will set you free. Okay, so last week we were on Facebook, YouTube, and we were talking about women's health. Some reason, no conspiracy theorist, okay? The feed was shut off to YouTube and Facebook, but it was going on to the Dr. BVIP. So that video is now on, but now we're going to talk about actually bursitis. So hopefully this will go on without any interruptions. We do have a censored version that the Minister of Truth will not allow because, if you're curious, we're living in a country that was of the people, by the people, for the people, and currently the ones that are funding the government, that's pharmaceutical industry, are actually controlling the government and the media. So they're also controlling the narrative. And what's cool about this is we're going to talk about bursitis. And this is like the simplest solution and problem that you could imagine. And you're going to see the medical world is completely insane with this. But the second part, I can't even tell you about what I can't tell you about. Oh, and by the way, if you can, hit the subscribe button, hit the bell down below, hit all the other stuff, because they have shadow banned and everything else. And I want to just like flood them with requests. You know, wouldn't that be kind of cool? Give them enough stuff that they can't ignore. Now, Dr. BVIP, thank you, everybody who's supporting that. I really appreciate it because we've been demonetized for a few years. The apprentice program is this Thursday, so it's Thursday at noon, and we're going to be talking about women's health, ovarian cyst, uterine fibroids, why they're common, and how they go away, and how to stabilize pelvis. It's going to be really a fun talk, and it's a doctorate level anatomy and physiology, talking about it down to like regular people so that we can understand it. And you're going to learn stuff that you can do, which is, it's actually one of my favorite courses. It really, really is. And we got the idea back when we were doing human dissections, and the Japanese student from Japanese Chiropractic Association would come here and we would do an entire body. And this is like down to nothing in 2 weeks. And normally the body would last like 2 or 3 semesters. And it was so much fun because it wasn't memorizing, regurgitating. Okay, it was if you impinge this, or if this is malfunctioning, what kind of symptoms result? What can you do? It was just so much fun. So that's what the apprenticeship class is like. We're also going to be having it hopefully on Extreme Health Academy, but Extreme Health Academy, I'm going to be on there again this weekend. Yes, it is 7 days a week. For about a 2.5 to 3 hour webinar, but get on there. It's really, really fun. So we're going to look at, and I'm going to try and hold it deadpan, because if you haven't seen the documentary, What is a Woman? Okay, the guy that's on there is really deadpan. And he asks a question like he's really expecting an answer. I can't do that because this is just ridiculous. We're going to go through some of what WebMD calls bursitis, and then we're going to go over what bursitis is and how to fix it. What is bursitis according to WebMD? You have these sacs all over your body. They're fluid-filled. They ease friction. It's between muscle, bone, tendons. What are bursitis causes and risk factors over age 40? Really? Why? Okay. Repeated pressure in an area, using a joint too much. High-risk activities, gardening, raking, carpentry, shoveling, painting, scrubbing, tennis, golf, skiing, throwing. Yes, any activity in the world puts you at risk. How stupid is this? My God, your business isn't essential. Stay home, we'll cut you a check. You just don't have to do anything. Okay? You can get bursitis by sitting or standing the wrong way. How dare you sit that way? Okay, sudden injury. This is ridiculous. Okay, so each one of these, and you're going to see this is continuing along here. Don't do any activity and you'll be okay. And I'm going to show you the real cause of it. Each one is like a miniature water balloon, a few drops of fluid in it. It's wedged between bone and soft tissue. It's literally, you've got tendons, okay, rubbing around each joint. This is how muscles attach to bones. And around those is this cushion that friction. Synovial membrane forms the bursa enclosed sac. It's very thin, it's few cells thick, and the fluid in there is viscous, thick. It's thicker than like WD-40. It's amazing. Now, bursas are real thin, okay? Some bursas, and this is kind of interesting, they form after you're born. So the more you use your body, the more they form and the healthier they become. Oh, wait, that's not what they say here. No, it's like, for goodness sake, don't use your body, it'll break. No, that's the exact opposite. If you got a 67 Ford Mustang and you want it to last, you don't drive that sucker. You want a body to last, you got to drive that sucker. Now, they're everywhere. Elbow, shoulder, hip, buttocks, thigh, Achilles tendon. Okay, now, it's interesting. How is a bursitis diagnosed? Now, this is the sick part, okay? X-ray and imaging test can rule out other problems that might be causing pain. MRI and ultrasound to give you an image of the joint, and lab test. Let me tell you, there is no bursitis that can inflame in a healthy joint. Okay, so when they're taking an X-ray, like let's say you have bursitis of the shoulder, you had better X-ray, what do you think? Everything around it? Like maybe the blood supply and nerve supply? You got to look at the whole structure. You got to see if there's altered mechanics. You know, they're talking bursa, X-ray the bursa. I mean, that doesn't make any sense whatsoever. Lab test. Yeah, you're going to do a sample of it. So how do you treat bursitis? Avoid the activity. Rest. Use crutches. Put a brace or a band. Ice the area. And take over-the-counter anti-inflammatory medications. And if you don't feel better after a week, they might give you drugs like steroids, which lower inflammation and pain. Your doctor might prescribe pills and needles. I mean, this is what we have. We're in the most psychotic world where no one is looking that your body is intelligent, giving you a symptom for a reason. And every solution happens to do with a drug. So let's look at orthoinfo.org. 5 interventions they can do for bursitis, and this hip bursitis. One of them, avoid the activity. Okay? How would you like to do that? What if your major activity is to play with your grandkids and you get bursitis after playing with them? Okay? Avoid them. Okay, non-steroidal anti-inflammatories. Okay, now ibuprofen. Now, you've seen our videos before. Non-steroidal anti-inflammatories. Inflammation is actually the healing process of the body. These things destroy the building block of cartilage. They damage the kidneys. They're toxic. They're going to destroy the ability of the body to regenerate healthy tissue. And so don't do any activities and take a drug. Now next, assistance devices. Yeah, nothing wrong with that. And if you're curious, look at walking canes as a defense mechanism or a defense weapon. You can bring those to the ADA. You can bring them on airplanes and everything else. And there's some martial arts using canes. So if you see a man with a cane, that's a badass. Okay. Physical therapy. Now, interesting, because physical therapists, if they understood biomechanics, it's not strengthening joints. Okay, when you look at your forearm, you've got muscles that flex it. Okay, you got muscles here that open it up. Should be a 5-to-4 strength ratio. So if you have bursitis to the elbow, let me tell you, it could be a muscle imbalance here from compromised nerve supply here. Could be altered mechanics during the day. There could be a lot of things. But generally, strengthening is not going to help. Okay, and then steroid injections. Steroid injections literally destroy the tissue in the area. Now, this is what we have. Institutional corruption of pharmaceuticals, the myth of safe and effective drugs. And I know safe and effective has a connotation in every, thing that you're hearing about now on every television station. Okay, it's the new religion. Let's look at this. This is 2013. The authorization of user fees in 1992 turned drug companies into FDA's prime clients, deepening the regulatory and cultural capture of the agency. The industry has demanded shorter average review times with less time to thoroughly review the evidence. Increased hospitalizations and deaths have resulted. No, I'm not talking about the current 2022. I know you're thinking, wow, some interventions rushed to market without good testing that were promised to do a lot of things that weren't promised. No, this is the destruction of the religion of pharmakia. Okay, now meeting the needs of the drug companies taken priority over meeting the needs of the patients. No, you will submit to our product. You will not have a job or school. No, it's not required. You just won't have a job or a school. Honest to goodness. Okay, this is 2013. No, they weren't prophetic. Okay, unless this corruption of regulatory intent is reversed, the situation will continue to deteriorate. We understand this. So, how do you prevent bursitis? Remember, the entire pharmaceutical industry is running this stuff. Okay, how do you prevent it? Use cushions or pads. If you're playing sports, mix things up. Warm up. Start slowly. Don't sit for a long time. Take breaks. Use good posture. Hip bursitis can have one leg longer than the other. Yes, I know. Keep your body weight normal. Okay, yeah, right. Okay, if it hurts, if something hurts, stop doing it and check with your doctor. This is stupid. Okay? I mean, it's just, has anyone in here ever gone to work hurt? Every hand should go up. Come on. You know, of course. Of course. You have to. You have to get the job done. Okay? And this is just crazy. So now you've got these sacs. You've got to look at the entire body all the time. Now, if that sac doesn't have fluid, and this is when you're looking at the entire upper extremity, you've got a rib cage here that's got the pump here. You got a small opening here called the outlet to the thoracic area. Why? Because of the thoracic, that's the outlet. Okay, if the head's forward or knocked off to the side, you're going to compromise the blood supply and nerve supply coming out. This is why when we talk about shoulder injuries, the top muscle at the very, very top, the one that's most predisposed to injury, is called the supraspinatus. And this is why when people come in and they say, yeah, doc, my doctor said that I had a rotator cuff injury. And you know, just for fun, the supraspinatus attaches right here, and I'll go in and go, yeah, it hurts right there, doesn't it? You know, look, you guys have fun too, okay? My fun's just a little sicker. Okay, so I say, yeah, it's the supraspinatus right here. It's real tender there too, isn't it? Oh, yeah. Yeah, and it's all from forward head carriage. Well, I mean, if you compromise, think of this. You've got a fluid-filled sac that the fluid is continually being replaced. And every time you use a joint, okay, you're opening and closing or increasing and decreasing pressure on this little sponge. Okay, so moving the joint helps the joint. Okay, it's not rest. Now, if you move a joint that has compromised blood supply, nerve supply, or altered biomechanics, that joint can't fill up with fluid. Okay, that bursa sac can't fill up with fluid. And this is the filtrate of blood. Okay, so just know that if it's inflamed from being dried up, how do you want to get blood to the area? Okay, now here's a trick. If I put a hot cloth on my arm and take it away, what color is my arm? Why is it red? Kind of. The brain senses that difference in temperature and it increases the blood flow to equalize that temperature throughout. It's brilliant. So we're kind of tricking the body. So if you put heat on a joint, you're increasing blood flow to the area. And I get this. Every time we get a new doctor, and we're getting them from pretty good schools, we got to retrain them because they're taught by rote. They're not taught why. Okay, so if you get a doctor that's reading, well, you have bursitis, so just don't do any activity. Right, I'm sorry. I live in the real world. Okay, so you got to get this shit working better. You put heat on it, That's going to rush blood to the area. It's going to increase the synovial fluid production, increase the bursa sac fluid. Any tissue damage in there, it's going to increase macrophage activity. It's going to increase lymph flow. And it's got to be moist heat in order to penetrate. But now that's only like a quick fix. If it's anywhere in the upper extremity, you got to look at the neck to make sure that everything is working correctly, because you don't want it. You want to continue to do the activity. You want to continue to do the golf or playing with the kids or whatever you want, okay? Yeah, you shouldn't be limited in your life. And when you look at the book, The Blue Zones, man, these people are swinging machetes when they're over 100, okay? And they're not going to be saying, oh, you know, swinging a machete is a repetitive motion injury. It's not repetitive motion injuries. You have two people working at a checking counter doing the exact same work. One person gets bursitis. Another person doesn't. What's the difference? Yeah. I know. You know, to find out the problem. Now, when we look at this, okay, Baker's cyst. If you understand that tissue has an integrity, okay, now that fluid inside of that sac, okay, that's creating then this is a knee joint. Baker's cyst is just a fluid-filled sac on the back of the knee. So that fluid, should it be in the back of the knee or the front of the knee? So does this mean, and again, let's just talk common sense. Since there's always fluid, blood flowing in there, and there's always fluid being produced. So if you have fluid that's building up, is that from a problem of stuff flowing into it or stuff draining out of it? Draining out. Okay, so that means that there was some kind of tissue damage to that joint, okay, clogging the valves that would drain the normal flow of fluid. Okay, does that make sense? Yes or yes? It's the same thing if you have an electron on bursa. Now, this is the most painful thing you can imagine. Okay, it's the bursa sac down here, and it swells up like this. Now, that one, you're going to need to cover. Okay, and this means you put an ACE bandage around it because you're creating a back pressure in order to allow that those valves to start to be blown out and drained. Plus, you have cells. Has anyone in here ever gotten a bruise? Okay, good. I know, we all have, okay. Well, what that is, bam, that's broken tissue. And that's blood that's leached out into the skin. So now you have cells called macrophage. Macro means big, phage means to eat. So these big eating Pac-Man-like cells, they get in there and they chew up the abnormally placed blood proteins, and the bruise goes away. And then all those blood proteins don't get wasted. They get shoved in the lymph. Lymph gets passed off to the liver. Liver starts to break everything down so nothing gets wasted. So if you create a back pressure on this, and this is how we fix Baker's cyst, you've got to first look at the mechanics. Now, any kind of hip issue or any kind of bursa on the hip, on the knee, on the foot, on the pelvis, do you think that person's going to be walking even, or do you think there's going to be a little gait abnormality? Little gait abnormality. So if you know that all the nerves that supply those legs come out of the pelvis and the low back, should you look at that area instead of just looking at the site? Okay, again, this is just common sense, something that WebMD does not have. Okay, and by the way, neither do any of the other sites. Okay, it's just like dumb. Okay, so this one, you have to distract the joint. We create a back pressure. We put heat on it, and the Baker's cysts literally go away. And it's amazing. But also, knowing that this is blown out, do you think maybe this person's under stress? Because if you're under chronic physical, chemical, or emotional stress, you don't have the major building products, okay, to build this stuff. And amino acids are the main protein or thing that you get from protein in order to build a healthy body, but that requires healthy amounts of stomach acid. So you have, if you're in a chronic state of stress, you have low stomach acid, so you can't build the quality that you actually need. Now, blood, knowing that we're talking about fluid flowing into these joints, you've got blood supply and nerve supply and biomechanics. So if the blood is not healthy, and this comes from diet, nutrition, exercise, detoxing, respiration, All of these things can help blood. Now, there's a lot of different interventions that are forced nowadays that are negatively affecting the blood that we can't talk about. But red blood cells should look separate. And that means because they have an electronegative charge. Now, if those red blood cells lose that electronegative charge, they start to get sticky and clump together. That means they can't hold oxygen. So you can imagine that if you have normal red blood cells, they're probably holding oxygen. They're able to get in the synovial membrane. They're able to produce the synovial fluid and the bursa fluid. They're able to do their job. They regulate the immune system. They balance everything. And they can go through a kidney really nicely. Okay, that's nice. Now, if they start to get clumpy together, they can't hold oxygen. Knowing that your body has to have oxygen and the blood is not efficient, what do you think has to happen to blood pressure in order to adapt to the blood that's not efficient? It goes up. Oh, how cool. Yeah, that's true. So the blood pressure would have to go up because it's not efficient at holding oxygen. So if you went to a crazy doctor that isn't looking at the health of the blood and your blood is in a stressed state and your body is adapting by having high blood pressure, what's the doctor going to say? Your blood pressure needs to be lowered. I am smarter than your body. No, seriously, I know it sounds stupid, okay? But this is our healthcare system. You're in 2020. The doctor is much smarter than your physiology. The leading cause of high blood pressure is idiopathic, which means it's unknown. But he does. Ask your doctor if this is right for you. He's the distribution arm of the biggest felon in the world. They paid billions of dollars in fine, but they are running your government. So let's say that you're not talking about soluble fibers like juicing, like blending, like vitamin C, like hydration. Okay, you're not talking about all of that stuff. You're not looking at a live blood cell analysis to see if the blood's healthy. Okay, and this person has bursitis. Heck, you're not even looking at the altered mechanics that could be present, altering the blood supply and nerve supply to that area. You're not even looking at possible muscle imbalances of somebody that's always flexing, having these joints not being functioning correctly. No, you're not looking at any of that. Okay, so the blood has a function. Imagine if your body gives symptoms for a reason. Now, if this can't get in there, like if you have chronic bursitis anywhere, you got a blood issue. And if it's in all your whole body, for sure, that's going to be the easiest one to fix. Okay, if it's local in an area, it's not just blood supply, it's going to be altered mechanics. Stress. Emotional stress increases blood viscosity. That means if right now you're kind of pissed off because you had multiple drugs and injections for bursitis, and you're going, oh my God, this is so simple. All you got to do is restore the blood supply, nerve supply, put some heat on it or some wrapping, depending on where it is, and it'll go away. That the bursitis isn't some weird demon attacking me, that it just has to do with altered mechanics and nutrients. Okay, that would make you upset. Now your blood is thicker. Wait, so does that mean that when we talk about, sorry, Joe, okay, we go back. Does that mean when we talk about physical, chemical, and emotional stress, you got to address all three? Absolutely, absolutely. Now, if you take a drug, because remember, we're a pharmaceutically controlled government, pharmaceutically controlled world. If you take an Advil, Motrin, or Aleve, it's all over the counter. Tylenol is not in this category because Tylenol doesn't know what category it's in because nobody knows how it actually works in the body. GI complications, heart failure, allergic reactions, miscarriages. I'm sorry. What did the doctor prescribe? What did the WebMD say? Oh, it's for bursitis. Okay, cardiovascular issues, gastrointestinal issues. And then if your bursitis, if your bursa sacs, okay, are not getting the fluid, does that mean the blood might not be healthy? Yes or yes? Okay, good. So if the blood's not healthy, if you're in a chronic state of stress, the blood still's got to go through these kidneys, 6 quarts every 20 minutes, and they're the size of your fist. Do you think that might have to elevate blood pressure to get it? Do you think perhaps under some type of physical, chemical, emotional stress, that thick blood being pushed through here could damage the nephron? Yeah, and that's why we see people will say, Man, I've been under so much stress and I noticed some blood in my urine. Okay, yeah, you probably got kidney damage. Let's find out what the problem is. And when you know that people that run marathons, okay, and particularly first timers, they can urinate blood for a week because that constant pounding can damage the kidneys. Luckily, kidneys can heal. But when we talk about inflammation, bursitis, itis means inflammation. Itis is tissue damage. I want you to understand this, okay? Because I have every time we get new doctors down here, I got to explain because all our doctors are critical thinkers, okay? And I want you to be a critical thinker. Itis means inflammation. That's it. But what's inflammation? Inflammation is a healing process of the body, and inflammation means there has to be tissue damage. So this is going to be revolutionary. So if you know that bursitis means that there's damage to the tissue, what do you think can damage tissue? Well, blood supply, nerve supply, direct trauma, that would be a good thing. What about encephalitis? Inflammation of the brain. There has to be what? Tissue damage. So what damaged the tissue? What about colitis? Inflammation of the colon. What has to be there? Tissue damage. See how cool it is? It's no longer a demon attacking you. Okay, so now we look at this, has all of these conditions, they're not inflammatory conditions, and inflammation is just attacking you. Okay, there has to be some kind of tissue damage somewhere. And if you understand that, then it causes you to be an investigator and to find out where that tissue is damaged, how is that tissue damaged. If you're talking the intestinal tract, you're talking chronic physical, chemical, emotional stress will shut blood supply down to the area. You could have direct trauma, okay, but it's more than likely a chronic state of stress. And look at these diseases. I mean, we're talking heart disease, cancer, Parkinson's, Huntington. All of these are from inflammation or tissue damage first. Tissue damage first. Tissue damage first. So when you get somebody with Alzheimer's and dementia, find the tissue damage. It's a tissue production problem. Does that make more sense? Is your mind blown yet? Okay, good. Yeah, because I want you to think different. Okay, so you got the four aspects of this. Swelling, heat, redness, pain. Okay, and this is the factors of tissue repair. Now, the difference between chronic inflammation and the death of 1,000 cuts is like the easiest one. You get one cut. If you have a normal immune system response and the cut's not too severe, you'll be able to recover. 2 cuts, 3 cuts, 4 cuts. Eventually, you could have the death of 1,000 cuts. And this means that all those cuts, and they're small cuts, but it eventually exceeded your body's ability to repair. Okay, and so you would succumb. So when you're talking tissue damage systemically, and this is tissue damage, like let's say, oh, you're following your pharmaceutical rep's advice, you wear a white jacket, and you're taking the Advil a day for bursitis. Okay, now that is damaging your kidneys and damaging your structure. Now, since it's not helping really, the pain's lessened a little. How's your sleep patterns? No problem, sleeping pill. Your joints aren't working right, and you're taking 2 drugs, and you're not sleeping well. You have a good attitude or bad attitude? Prozac. Okay, good. So now the side effect of Prozac is suicide, suicidal thoughts, and suicidal ideation. The side effect of the non-steroidal anti-inflammatories is joint destruction and kidney damage. And the side effect of the sleeping medication is anxiety, stress, and sleeping problems. Okay. Your shoulder's still tight, muscle relaxant. That's a central nervous system toxin that's going to attack the base of the brain. Now, all of these, are these helping your body regenerate tissue? Or are they damaging the body further? Anybody suffering from Advil deficiency syndrome? No, that's foolishness. Okay. So understand, you have inflammation. Inflammation is tissue damage. So repair the tissue. Okay? I know. I'm going too fast. No, because people out there are going, oh my God, my mind is blown. You know, dear, get me another Advil. Okay, this is just figure your body does this a billion times a day. You tear down a billion cells and you build them. And the body doesn't do anything half-ass. When it does that inflammatory response, okay, it creates free radicals. Now, if you have something with a boatload of electrons, like blueberries or juicing or blending or plant products or vitamin C or omega-3s or glutathione, all of these things are antioxidants that can deactivate those free radicals. So even though they're called, like oranges are called anti-inflammatory or blueberries, they're not against the inflammation. They just deactivate the free radicals so the inflammation can be effective at working and fixing the job. Now, here's some things that we can talk about: poor diet, drugs, pollution, injury, natural aging, and stress. And there's something in there I can't talk about. But all of these things can damage the body, okay, because they damage tissue. If they damage tissue, they cause inflammation. That's the inflammation repair process. Now, when we're looking at bursa sacs in the entire upper extremity, you have one bony attachment. That's the clavicle. You got 18 muscles that guide the action of this shoulder joint up and down and around. Isn't that cool? Okay. Now, 18 muscles, one bony attachment. Do you think that if you have a bursitis of the shoulder, elbow, wrist, okay, that maybe you should look at the neck, the blood supply, nerve supply, or how that shoulder goes up? I mean, common sense or common sense? Okay. How could you possibly address bursitis in the shoulder, elbow, wrist, without looking at the blood supply, nerve supply, or biomechanics? You're right. That would be not smart. I'm not going to say stupid anymore. It's just not only not thorough, it's ridiculous. But if you know that you're in a profession that you can't correct that, and this is why the system today is so messed up. If we see a structural deviation of the thoracic area causing an altered biomechanical movement of the shoulder, we can correct it. Okay, unless it's fused or something else. I mean, we're taking stress x-rays, but we actually do before and after x-rays to change the structure of the body. Okay, and I mean, because you find the problem and you can fix it. Now, knees, I'm really familiar with this. And okay, I have a facility that we're one of the only licensed facilities in North Mexico. We grow our own stem cells. Okay, and I have been looking at them, studying it, everything else. And my knees, I've broken my right knee twice, my left one once. And I have to do my knee exercises all the time. They're fine. I can bend, turn, twist, everything is great. But they're unstable because every time they did an operation, they removed the meniscus. So in the next 2 weeks, I'm going to have two things. I'm going to have a direct injection of stem cells and an IV injection of stem cells. And I'm going to film the whole thing. Yeah, I don't know how it's going to come out either. Okay. But before we recommend any kind of stem cells like that, I say, look, don't do it unless you get the blood supply, nerve supply, biomechanics working right. I mean, I don't have any bunions on my feet. My feet are fantastic. My calves are working excellent. I demonstrate everything. My back is like strong as hell. Okay, so I don't have any altered mechanics. So I'm like the ultimate guy to do it. And I have one other patient from Canada who's just like that, So I'll let you know. But if you know, that lumbar should be straight up and down. You can see the person standing there. It's not. It's twisted all to heck. Now, the third lumbar nerve goes to the knees. And this is the mnemonic: 3 to the knees, 4 to the floor. Okay? So the fourth lumbar goes all the way down to the floor. The third lumbar goes to here. And the second one goes here. The first one goes here. T12 goes here. So it's all coming out of there. So does that mean that if you have a hip bursitis, you should look at the thoracolumbar junction? Because this is T12, this is L1, this is L2, this is L3. And what's a trip is when your doctors, okay, the patient, and one of the most brilliant doctors that was one of my instructors, he said to find out what's wrong, ask them. And then you got to do another thing. You got to do, and this is harder, you got to listen. Okay? But patients literally will tell you, and they'll go, Doc, man, I got this pain going right here. That's the 6th cervical nerve root. I know exactly what that is. Or coming down here, right here. That's the 7th. This is the 8th. And they'll trace the nerve coming right out of their body. It's really simple. So hip bursitis, knee bursitis, foot, ankle, okay? Any kind of bursitis there, you're not going to have a good gait, so you cannot correct it unless you stabilize the pelvis. And the pelvis can't be stabilized unless you check the lumbar. Okay, does that make sense? Stabilizing the pelvis, we recommend a trochanter support, or you can sit like a cowgirl sitting backwards, or a cowboy. So the femurs will actually approximate the pelvis and take the stress off. You got to get the foot exercise in the back of the leg. It's called the soleus muscle. Like everybody's heard of the Achilles tendon, right? Okay, what's the other name of it? No, this is actually a board question. Okay, it's called triceps surae. And so there's 3 muscles that attach to it, and one of them is the soleus. It's actually the pump. Okay, so that pump's not working right. Wait, we were talking about how bursa sacs are filled with fluid. And so if you have a pump on the back of the leg that's not working correctly, do you think that might be a contributing factor to every ankle, knee, and hip issue? Absolutely, yeah. So you got to check the whole thing. Now, I get a lot of crap for that picture up there. Good shoe, kinda. The high heels. I was raised with 3 older sisters and a mom who had high-heeled tennis shoes. My wife is 4'11". If I ever suggest no high heels. Okay, you did. Yes, thank you, brother. Okay, we have similar wives. Yeah, so that's a good shoe. You can do stretching. You can do a lot. It makes the legs look longer and the butt stick up. Girls like wearing it. I wouldn't recommend wearing it for playing tennis. But if, any damage that's done while you're walking around in high heels, we can fix it because the benefit far outweighs it. To distract the joint is amazing. Now, you can do this exercise, very, very simple, where you're opening up that joint. Because now if you have a negative pressure, it's just like pulling a jelly donut apart, negative pressure. That fluid's going to be sucked in there. So if you have any hip issue, putting a small weight and just dangling it like a pendulum. You'll see the heel is level with the toe, then the toe is level with the heel. So just very, very simple. These are all ligamentous-based exercises that work fantastically well. The sitting. And this is going to be for the low back, every lower extremity, and all the upper extremities. When you're sitting, if you're sitting and your head's forward like this, you're shutting off the blood supply to the outlet of the thoracic area. If you force the curve in the low back, you're repositioning the chest, and that's amazing. And this is, we use little foam pieces here. You can use a water bottle, rolled up towel, anything, but the bottom of the elbow is where the bottom of this goes. It's incredible. So when you're talking bursitis of the elbow, do we suggest sitting differently? Yeah, absolutely. Now, we're not going to be like WebMD to say, wow, if sitting causes problems, don't sit too long. Right. Okay. How many people want to drive to Phoenix from here? Okay, we'll be sitting for 6 hours. No, you got to get stuff done. Yeah. Turmeric. And this is interesting out of arthritis research. It helps establish a microenvironment which pro-inflammatory cytokines. Cytokines means cell type. That's all as fancy as that is. Pro-inflammatory means that they're trying to repair. Okay, they're not cells that go in there and they start to damage tissue. Okay, are antagonized, facilitating chondrogenesis. Now, this is regenesis, generation of cartilage. Okay, that's the chondrocytes. Okay, this is literally how that is formed. Is that cool? Yeah, particularly knowing that non-steroidal anti-inflammatories like Advil, Motrin, and Aleve, okay, ibuprofen, all of them, they destroy the cartilage, and turmeric helps the cartilage. And I mean, antioxidant, antimicrobial, anti-neoplastic, which means anti-cancer. Why not let food be your medicine and medicine be your food? Yeah, you can quote me on that. No, I ain't the original, but yeah, you can quote me on that. Okay, you heal the gut. So when you have bursitis, is blood health important when you're talking about bursa sacs? Yeah, so this requires you to optimize your gut flora. Juicing, blending, healthy fermented foods, raw dairy, K2, D3. I mean, it's just you're going to eat the way your great grandparents ate, but they only ate organic. They only ate whole foods. They only, ate seasonal. Okay, and they walked and they worked. I mean, it's just amazing. Glutathione, the most powerful antioxidant. Because remember, what are we talking about? I'm putting up all the antioxidants up here because inflammation creates free radicals, and the antioxidants allow that inflammatory process to work. Garlic, onions, broccoli, kale, cabbage. I mean, I don't want you to, we have too much of an allopathic feel. Like, what's the supplement I can take for bursitis? No, you don't want to do therapies like that. What's the supplement for brain function? No, you want to change the communication from the body to the brain. You understand that these biomechanics communicate to the cerebellum, and that cerebellum controls the frontal lobe. Okay. Yes. Some people recognized her. Okay. This is a gal with hip issues or doing the splits. Okay. And you don't need perfect hips to do it, but I just think this is cool. But when you look at this, how do you correct a hip? It's not just a hip. Do you think you got to fix the feet, the calves, the pelvis, the lumbar, the cervical? It just makes sense. So things not to do. No rehab without correcting the biomechanics. No rehab without cervical, thoracic, lumbar, and pelvic correction. You got to correct the pelvic instability before you correct anything else. You must correct the cervical and thoracic spine before shoulder, wrist, and elbow. I mean, this just makes sense. You got to make sure that the nerve supply and blood supply is working well. And look, the bursitis is never the problem. It's the alarm that tells you is no ice on bursitis and eliminate the drugs that are reducing the body's ability to heal. I mean, that makes sense. Get full x-rays, use moist heat for fluid regeneration, get the foot and calf exercises. And a lot of times, and we have a great exercise using a rubber band, but we don't give it on the first visit, okay? If a person has altered neck or forward head carriage or reverse curve, I mean, you're asking them to do an exercise, well, they got a tourniquet on, okay? Give them a week of adjustings, and then you can start doing it. And then deep sleep. That's why we have these 5 keys: healthy nerve supply, good exercise, appropriate nutrition, sleep, and prayer and meditation. I mean, it seems too simple, but evidently it's bigger than WebMD can come up with. Okay, so the advice is like so bad. Just go 180 degrees, and you're probably going to be doing something good for yourself. Okay, we're going to start in the unapproved section now. And so now, if you're watching us on Facebook and YouTube, I'll see you back next week. If the powers that be don't cut us off again. And I'll see you Thursday for the apprenticeship program. We're talking about women's health on the Dr. BVIP, 12 o'clock, high noon, California time. But now we're going to get into some scary stuff. So God bless you, and I'll see you next week.